Yeah, we're very proud to be the first biologically validated AI in the world. And what that means is that the predictions and forecasts from our machine or AI have been proven to be accurate and true by multiple third-party organizations. And what they've done is that we followed up those predictions and forecasts with lab tests, lab results, lab panels, EMR, medical follow-up, as well as hospitalization and infection. And the accuracy of that, the biological confidence level is 95 to 99%. Very true, and it's a very good question. Like, if you look at the show today, the number of companies that say they have AI at HIMSS, and the first HIMSS day was all AI, well, it's just not possible. And we are very proud that we are the first AI to be applied at scale for patient health. So we're not talking about AI for claims or for onboarding or things of that nature. This is actually impacting the patient's health trajectory. We're very excited. We're deployed in the US and globally. In terms of clients, we have 14 clients. Those are payers and providers. Our largest client for medical AI is a Fortune 5 payer, which I'm sure you can probably figure out who they are. And the product itself, medical AI, does 5 things. So first, as soon as you turn on the product in your environment, it gives you a real-time risk stratification of all your patients. Now, risk stratification itself is not novel. However, the real-time portion of that is, rather than Johns Hopkins 27 months of hydration. Number 2, milliseconds after it does the risk stratification, it predicts the risk of the patient in the future. Will that patient get better or will they get worse? And number 3 is, what is the next best action for the care team and the patient to take in order to get that patient better or stable? And then finally, we predict the transition from one state, maybe diabetes, into chronic kidney disease, or CKD 1 to 2. And also, what is that next best action to retard that transition? And finally, finding for payers unknown patients. So there is 30 to 40% of the population that have chronic kidney disease don't know they have it. And we can find those people for our clients so they can get on medication and a treatment plan faster. Our medical AI currently is deployed in 3 disease states. So chronic kidney disease, end-stage renal failure, prediabetes, diabetes, cardiovascular disease, coronary heart disease. We will start deploying mental health AI or depression AI in Q3 of this year, and COPD or respiratory AI in Q4. And in the first quarter of 2024, we're going to be launching our high-risk pregnancy AI. There are a lot of successes and a lot of challenges over the growth of our company over the last 4 years. What I'm most proud of is being the first to be biologically validated. We're also proud of being the first AI to apply AI to patient health at scale. And we're talking about 40 million people, over 1/10 of the US population. I'm also proud of our accuracy. We identify patients with an 88.5% accuracy. Our renal AI is 85% accurate. And those are things that we're very proud of. If you're going to do anything worth doing, there's always hurdles and challenges. And having founded the company 4 years ago, we have gone through that. Not everything has been easy. And the development of our AI is truly a scientific process. It's not just putting a couple data scientists in a room with some data and trying to figure something out. It's actually going through the scientific process, making those adjustments, and bringing it to the product to where it is. And because of that, that's why our product is so good, because we've taken those 4 years of research and development to achieve that. So the future of healthcare and AI are intertwined. And if you look at HIMSS with the number of people saying that they have AI, which I don't believe, but it's going to be a larger part of our care delivery system. And that's going to be not only in our system, but globally in the socialist medicines as well, because the amount of data that is being obtained and stored about each one of the patients is getting larger and larger. So I think that you're going to see that doctors are going to be using this to increase the accuracy of diagnosis. I think you're going to see things like computer vision, like radiology and CAT scans, and you're going to be identifying disease states earlier, and people are going to be able to catch those, so preventing people from dying early or whatnot, or extending their lives. And I think it's it's something that's going to probably extend the life of people. The reception of doctors to medical AI, we were nervous about that, right? We figured it was going to be 50-50 with the physicians. And when we worked with medical payers and the medical director at those, when they talk to a doctor or a physician about changing their treatment plan with a patient, the underperforming doctors usually say, you don't know my patient, right? Now the medical director can actually say, actually, we do know your patient mathematically, because we have 10,000 that are just like that. So the medical directors at first were not as receptive, but once they could see the use of that to discuss changing treatment plans for the better of the patient with other doctors, their interest really took hold. The second part is I thought it was gonna be a 50-50, as I said earlier, but we probably had about a 90% of the nephrologists were really excited to see our renal AI. And again, those are positive people coming to us proactively. But I think this new generation, and as the older generation ages out, I think it's going to be a high adoption rate. They're really not going to have a choice.